Okay, it's been some time since I created any video content because I've been really busy, but I'm back to doing it because I've got issues to highlight, or rather I've got issues to nag about. Okay, so basically I had a patient who came in, or rather who called, well, there was a lady who called. I wouldn't call her a patient, she's not my patient. A lady called that day asking if we have the P10 mask, and I said yes, we do, but we generally do not do retail sales from the clinic, right? So I asked her whether she needed a mask fitting. So she said, oh, but my son says this is the best mask, so I think, you know, I think it's the best mask for me. I think I want to get this mask. So I said, okay, what size nasal pillow do you use? I mean, I know the P10 mask actually, well, the mask kit actually comes with 3 different nose pieces, but I always make sure not to leave it to the patients to decide which nose piece they want, because more often than not, patients are often in denial. They always think their nostrils are very tiny. Everyone chooses the S size. Okay? So I told her, okay, calm down, I will mask fit you, I'll make sure that it fits you properly before you go off with the mask. Right? And she said, okay. So she came down, so we had a short chat, and I asked her how her progress was, how long she's been using the CPAP. So she said, oh, she's been using it for quite some time, all is good, everything is okay. Well, but we know okay is subjective, right? Okay, so then I asked her, I said, okay, so your doctor thinks all is good? And she said, oh, I didn't go to a doctor, I didn't do a sleep test. So okay, number one, the problem with that is, yes, I mean, of course, for some people, the symptoms are so obvious, right? The signs and symptoms, the loud snoring, witness gasping, witness apneas. Yeah, but sometimes we would like to know what your baseline was. And without a sleep test, it's very hard to ascertain whether the central apneas that we see after you start your CPAP is treatment emergent, or whether it was there all the while, even without the CPAP. Yeah. So I asked her, I said, okay, you didn't do a sleep test, you didn't go to a doctor. Surely you have the vendor that you bought the machine from to follow up with, right? And she said, no, I didn't buy it from here. I bought it from, I think from online, or was it from Australia or something like that? I think she bought it from Australia. So yeah, no one's managing me. So I asked her, then how do you know you're doing okay? Or what makes you think that progress is good? She said, oh yeah, I think I feel better now, you know. Okay, so I offered to take a look at her data over the past, I don't know, past few months, past few weeks. So I told her to go back, take a picture of the serial number, device number, send it to me. Hopefully, okay, try my luck. Hopefully, if the unit is not locked under another vendor, I would be able to retrieve her data to, remotely monitor her and do whatever settings I need. So yes, thank goodness, I managed to retrieve her data. And okay, what was very shocking is, okay, firstly, compliance is very bad. Okay, I think in 3 months she's probably just used it like 4 times. Okay, so that is not okay. That is not what I call the progress is good. Like, what progress? It's 4 times in 90 days. Right? So I think that's an issue as well. When you don't go and see a doctor, when you don't do your sleep tests, you take things very lightly. Using the CPAP machine becomes like using a massage chair. If I feel I like it, I use it. If I don't feel like it, I don't use it. Right? So I told her, I said, hey, your compliance is so bad. Why do you say it's okay? And what's worse than the compliance is that for the few times that she used it, her AHI was over 50, 50. So here I am wondering whether if without the CPAP, her AHI would have been higher, or whether it's because of, and she presented with a lot of central apneas. So I'm also wondering whether, it's probably because of CPAP therapy that has caused centrals to go up. So then I noticed something which was even worse, okay? Over the 3 or 4 days that she used it, each time that she saw that the pressure was high, not the pressure, the AHI was high, she would up the pressure by 2. So for example, for day 1, it was maybe like 51. So she increased the maximum pressure from 12 to 14, right? Then on day 2, when it became 58, she actually increased it to 16. Yeah? So the centrals got higher, right? Every time she increased the pressure. So obviously the AHI went higher and higher and higher. So that is the issue I have with patients who would argue with us saying, this is my money, I bought the machine, so I should be able to adjust the pressure or the settings according to what I think I like. So I always tell the patients, it's just like you going to the doctor and taking 10 Panadols, like instead of 2, because it's your money, you paid for it, so you can take as many as you like, take as many as you wish, right? So the problem is patients tend to think that it is as easy as turning on the aircon, right? When I'm feeling hot, I'll be like, okay, it's time to lower the temperature. When I'm feeling cold, okay, let's increase the temperature. Okay, all is good, I feel good now. But what they don't realize is titrating the CPAP pressures are not that easy. So what a lot of patients do is, oh, my AHI is high, right? I'll increase the pressure. I mean, isn't that right? Yeah, isn't it the right thing to do? No, it's not, okay? In her case, because it's mostly centrals, right? So the more she increased the pressure, the worse the centrals became. And she wasn't even giving her body time to actually adapt, right, to it. She was changing it daily, up by 2, up by 2, up by 2. So there are a lot of things to balance when we actually titrate the pressures for CPAP therapy. Yeah, I mean, which is why we needed to take exams. We needed to be board certified to do this. It's really not as simple as, oh, when this goes up, I should increase this. You know, when this goes down, I can decrease it. So for this lady, her leaks were so bad that the machine actually stopped on its own. Yeah, it auto stopped. So it has to be very bad. It had to be very bad for the machine to auto stop, because sometimes when you remove the mask and you leave it on the bed against the pillow or something, as long as the machine can sense like a resistance, it doesn't even auto stop. So when it's on her face and it auto stops, it just means that it was really high. The leaks were really high. So I think the first thing which should have been addressed should have been the leaks, right? Because there's no point increasing the pressure increasing the pressure if you're not taking care of the leaks. As how one of my patients described it, he said his mask keeps levitating throughout the night. Yeah, but that's because the setting which the previous vendor had set for him was 4 to 20. Okay, it wasn't even a setting, it was the factory default. Yeah, so when there's a leak, right? When there's a leak, machine compensates for it by increasing the airflow. So it's like a chicken and egg thing. So you feel like a surge, and that's where patients feel uncomfortable. So if you don't take care of the leaks, no point, right? So her leaks were also so bad that turning the humidifier to 8, the maximum of 8, wasn't working. I told her even if there was a 20, it's not going to work because your mask is leaking so badly. Whatever goes in comes out, right? And she was like, oh, okay. So there are a lot of things that people don't understand, and they think it's very easy, and they think that we are trying to get them to come back to us for reviews because we want to earn that money. No, I don't mind not earning that money, but can you imagine using a CPAP for the next 5 years, 10 years, not knowing that your AHI was 50 plus a night? And that is why we do have patients, or we did have patients who were complaining that, when they first came to us, they said, oh, people tell me that by using the CPAP, my blood pressure should go down, but no, it's still very high. No, it's not using the CPAP, it's using it effectively, right? Making sure that your apneas are reduced, are greatly reduced. So if you're going to use the machine on a daily basis, if you're really compliant, well, good, for the next 5 years, but your AHI is like 50 or 60 a night, it's not going to do you much good, I don't think your blood pressure is going to come down. I don't think your heart's going to be any less overworked than it was, or than it is without the CPAP machine. Yeah, so I think it's very important to be following up with whoever, okay, or find a way to get your data downloaded to see how you're progressing. Yeah, so please don't save that money. Yeah, and just get someone to manage you. I'm not asking you to come to me, you don't need to come to me, okay? But go back to your doctor or go find a vendor to manage you, okay? If not, what's the point of using it for the next, even the next 50 years? I mean, and using it every day. Yeah, it's not going to do you any good, all right? Okay, that's all for now. Bye.